professionals like physiotherapists, surgical and anesthesia-related technology professionals who are part of the current healthcare system. However, this strata remains unregulated and underutilized. The bill seeks to regulate and standardize the education and practice of these professionals. To discuss the bill, I have on the show with me Dr. Girish Tyagi, Registrar of Delhi Medical Council, and Ms. Kavita Narayan, Public Health Expert at the Ministry of Health and Family Welfare. Regulating and establishing a standard of training for allied and healthcare professionals can reduce the cost of medical care and improve access to quality healthcare services. The purpose of this bill is to improve the access to quality-driven services by establishing a regulatory framework that sets standards for education and practice of allied and healthcare professionals.
Allied and healthcare professionals have been part of Indian healthcare system. They provide services that deal with direct patient care, such as physiotherapists, or services that support the diagnosis and treatment of any illness, disease or injury, such as lab technicians. Currently, there is no mechanism that regulates the functioning of these professionals.
We provide mainly two roles, in a preventive treatment form and also preventive education. According to the WHO, the Asian country, mainly India, will going to affect mainly posture related problems like spinal problems and various joint diseases. And these are the problems which is due to musculoskeletal problems. And in this, our professionals are very expert as compared to other professionals, because the physio's syllabus are mainly focused on musculoskeletal system. And according to the medical evidences, it is shown and proved that musculoskeletal system operates and also stimulates various systems.
The bill includes a schedule which lists certain services as allied and healthcare professions. They include life sciences, surgical and anesthesia-related technology professionals, trauma and burn care professionals, physiotherapists and nutrition scientist professionals.
न्यूट्रिशनिस्ट बनने के लिए सबसे पहले ये ज़रूरी है कि +2 में आपके पास साइंस विद बायोलॉजी एज अ सब्जेक्ट होना ज़रूरी है. उसके बाद यूनिवर्सिटीज़ में आपको जो कोर्स ऑप्ट करना है दैट इज़ ग्रेजुएशन बीएससी इन होम साइंस. उसके बाद आगे बढ़ने के लिए हर यूनिवर्सिटी का अपना अपना अलग सिलेक्शन प्रोसीजर होता है. बीएससी होम साइंस में आगे आप स्पेशलाइजेशन करते हैं फूड्स एंड न्यूट्रिशन में. उसके लिए आप मास्टर्स भी कर सकते हैं ग्रेजुएशन के बाद, और एक डिप्लोमा कोर्स भी यूनिवर्सिटी के थ्रू दिया जाता है. दिस इज़ द राइट चैनल टू ऑप्ट फॉर अ डाइटिशियन.
The bill goes on to further categorize allied health professionals and healthcare professionals. An allied health professional is someone trained to support the implementation of any healthcare treatment recommended by a doctor. The professional should obtain a diploma or a degree with an experience of at least 2000 hours. A healthcare professional is someone who provides preventive, curative, rehabilitative, therapeutic, or professional health services. The professional should have obtained a degree with an experience of at least 3,600 hours. The Allied and Healthcare Professions Bill 2018 was introduced in the Rajya Sabha by the Minister of Health and Family Welfare, Shri Jagat Prakash Nadda, on December 31st, 2018. The bill has been referred to a standing committee for further recommendations.
Dr. Tyagi, let me begin the program with you. Can you tell us a little bit about who are these allied professionals and who are these healthcare professionals that the bill is talking about?
The bill is talking about physiotherapists, OT technicians, audiometrists, and lab technicians. These are mainly.
So these are a lot of the people that when we go to a hospital, we see on the sidelines, in addition to the doctors and nurses. Kavita, you want to tell me a little bit more about, what is the granularity? Because I think the bill has a schedule at the end which lists down a number of these things.
Sure. So what we've tried to essentially do as part of this bill is really make this very understandable, because we, as I think we sort of discussed earlier, the understanding of who these allied and healthcare professionals are really is one that we are just about sort of gaining understanding on in this country, as I'm sure we've spoken about. So when we say the word allied, historically, we've always said paramedics. We've used the word paramedics to sort of look at anybody who's not a doctor, who's not a nurse, and we've said they are paramedics. Now, the word paramedic is a major misnomer, because paramedics are those that actually operate ambulances. They are those that in the US, for example, we call, these, when you call 911, the guys that come in and rush in are paramedics. So that's only covers sort of one aspect of this entire spectrum of people that come under the allied and healthcare professionals ambit. This bill basically attempts to really classify them on an international code. So there is the international standards of classification of occupation that the WHO refers to. It's also sort of, it's the ILO, the International Labour Organization, also refers to it. So we have tried to use those codes so that it is standard not just for India, not just for today, but we are also sort of globally equivalent. So we've really tried to give the codes. You will see in the bill, there is a numerical schedule that sort of matches every single, profession. So we've said all of these people are understood as allied and healthcare professionals globally, and that's where really it's India's time to also now sort of move on. And that's how this schedule was sort of thought through.
Okay. I'm so sorry.
Sure.
Dr. Tyagi, I just wanted to ask you, earlier on the program, we said that there's a schedule at the end of the law. It puts together 15 broad categories and 53, professionals underneath that. What is the requirement? How do you, is there an educational requirement? Is there an amount of course that you complete? So what does the bill talk about that?
Basically, the requirement is that it is till now it is a unregulated sector.
Okay.
Just because we don't know about the qualifications or the competence of the person, whether doing service at the government sector or the private sector, because there is a need of that all the sectors, like lab technicians or OT technicians or X-ray technicians.
So when you say unregulated, what does that mean?
Unregulated because there was no controlling authority, because at Delhi, I am talking of Delhi, there you go across any government hospital, say AIMS or something, there is a mushroom of labs. There are collection center, and nobody knows about who is collecting center, what is how the lab that collected center is being controlled, or how does this.
Okay. So what you're saying is that there's no minimum standard which is there, which will say as to whether a technician is operating an X-ray machine is qualified to operate it. So he might have studied somewhere, and somebody else in another hospital might have studied somewhere.
He might be only 8th class or just assistant to a lab. Then he claim himself to be a lab technician.
Okay. So Kavita, so clearly there was a need for some kind of a regulation. You want to elaborate on as to why is the law needed now for this?
Sure. So it's interesting when you look at the history of how this developed. In 1953, 54, etc., we had a very, very famous, we had some reports called the Mudaliar report, we had the Bohr committee report. These are all reports that are now more than, 50, 60 years old. Even in those reports, there was a need mentioned that in addition to sort of the nursing council, the medical council, the pharmacy council, etc., which were all established very close to independence, there was a need expressed to say that allied healthcare professionals must be also regulated. There must be a set of structure and standards that are put in place. However, it's very interesting that we've taken a long time in that sort of coming up, partly also because the reason we've sort of, they have been sort of, we've understood the doctors, we've understood nurses, we've understood, pharmacists to an extent. But beyond that, and dentists, of course, because dentists also come, sort of close in line along with the doctors. But this whole other group has been sort of a very, sort of a mixed bag, and there's not been enough understanding. Now, there was the Rehabilitation Council of India, the RCI, that was established a few years later, obviously. And in the 90s, there was people such as the prosthetics and orthotics. Now, these are people that are actually making implants for your knees, for example. Now, that group fits under there. The speech and speech therapists and audiologists, these are people that are again looking at your speech and your hearing. These folks also fall under the Rehabilitation Council of India. The physiotherapists and occupational therapists at one point belonged to the Rehabilitation Council of India, but then later on they chose to come out of it. And now they are basically, they are a prominent part of this bill, but they chose to come out of that because they felt that their treatment and their scope of practice, etc., was a lot more than sort of what the the RCI spoke about, because the RCI is concerned with disabilities mostly. It sits currently under the Ministry of Social Justice today, whereas this bill sort of expands the whole continuum of care that they can provide. We call it therapeutic, we call it diagnostic, we call it rehabilitative, curative. So there is a whole range, and so that's how so there was an understanding, and we had to wait for the evolution of today from those years because of the large number of professional groups that have also emerged today, and therefore there is really a need for us to sort of ensure that there are standards.
Okay, Dr. Tyagi, very briefly, so you are a member of a current council which regulates a certain part of the healthcare sector. So what is the need for having a regulatory body? What does a regulatory body do in the entire healthcare space?
Because we have come across many complaints against the labs, and because the nursing homes or the hospitals are being covered by the Nursing Home Act,
okay,
or in differentiated by the Clinical Establishment Act. Since the Clinical Establishment Act is not applicable, it is the nursing home and hospital are covered by the Nursing Home Act. And since the labs, they are not covered by the nursing. They are not being registered by the Nursing Home Act.
So what you're saying is that there is a gap.
Yeah,
there is an institution that is covered, and there are people within the institution who are not getting covered.
We have received a number of complaints against the lab, and we have sent letters to the Delhi government to take action against those labs which are not functioning properly.
Okay.
The pathologists not being employed, radiologists not being employed. Their pathologists are lending their signatures, or technicians are not qualified. But till now.
Okay, so what this bill is going to do is it's going to standardize some of these things, and it's going to fill a gap in an unregulated area in the healthcare space. Okay, it's time for us to head into a break. When we come back, we will discuss the provisions of the details of the different institutional authorities that are being established under the bill. Welcome back. On the program today, we are discussing the Allied and Healthcare Professions Bill of 2018. The bill seeks to regulate and standardize the education and practice of allied and healthcare professionals. It sets up a regulatory mechanism at the center and state level to establish certain standards of education and practice for these professionals.
The bill sets up the Allied and Healthcare Council of India, consisting of 48 members. The role of this council is to frame regulatory policies that will impact the education and practices of allied and healthcare professionals. The council will also provide for a uniform entrance and exit exams for the allied and healthcare professionals.
In the current state of healthcare system, many allied and healthcare professionals remain unidentified, unregulated and underutilized. India's health system is highly focused on efforts towards strengthening limited categories of professionals such as doctors, nurses and frontline workers. So recently in 2018, Union Cabinet has approved the Allied and Healthcare Professional Bill that aims to regulate and standardize the education and services by allied healthcare professionals. The bill provides for structure, constitution, composition and functions of Central Council and State Councils, for example, framing policies and standards, and also providing provision for a common entry and exit examination. Also, offences and penalties clause, it has also been added to check for malpractice. So I think it will take some time, but looks like a right direction to strengthen the foundations.
Under the provisions of the bill, state governments will be required to set up state allied and healthcare councils. These councils will consist of 29 members each. The councils will be required to ensure that allied and healthcare professionals follow the laid code of ethics. They will also register and inspect allied and healthcare institutions. The councils will be responsible for the conduct of uniform entrance and exit examinations.
For good governance, allied professionals require an equal contribution, which is missing in this bill. Let's say for physio department in allied healthcare, there are very limited points in favor for physios, which will bring harmony in working of allied professional bill. In current bill, the physios are mainly governed by bureaucrats and there are very less physios. So it will give a resistance in motto of working of allied health system. So it's important that physio should be increased so that it give a proper working of a allied healthcare system.
All allied and healthcare institutions are regulated by the Allied and Healthcare Council of India. Any changes made to the structure or capacity of the institution must have prior permission from the council. Institutions that do not conform to the standards of the councils may lose the recognition granted to them.
Kavita, let me get to the meat of the bill. So clearly, health is a state subject. So Parliament is now enacting a law which is going to set up a regulatory environment. So can you walk us through as to what are the different tiers of regulation that Parliament is setting up through this bill?
Sure. So I think somebody articulated here fairly nicely. If you look at regulation, and I think we've said this a few times before, you really want to look at the standard of practice, and you also want to look at the standard of education. So what is being taught, what is being, in terms of the institutions that are there, and what is the kind of practice that we are allowing these professionals to do. Those are really the two major aspects that, if you look at any regulator, that's what we're looking at. But here in the structure of the bill, we've looked at a central council, a central mechanism, which consists of obviously major ministries that are represented, that all have a say here, but also has enough representation from all of the major categories. So all the 15 categories that we are talking about, there is representatives from there on this bill. And the way we try to sort of enforce the standards is by having individual professional advisory bodies for each of those groups. And then people are represented from the advisory body onto the council, so that the individual concerns, standards, etc. for each of the professions are directly brought on board by that particular group. So that's one of the primary structures, if you look at sort of how the structure is looked at. We have doctors on this bill. We have charitable institutions that are doing good work that are also represented as a constituent. The multi-stakeholder nature of this bill is very different from what you would see, let's say, in the medical council, nursing council, etc. Because we've realized that this healthcare today is much more of a multidisciplinary subject than it ever was before. It is not only the doctor's domain, it's not the nurse's domain. It really involves a whole group of people coming together. And so you will see that reflected in the structure of sort of the composition of how this council works. Now, it's your very, very important point of how the states are sort of linked in here. The central council is sort of framing the policy, so sort of ensuring that the actual law is made, is that the regulation is actually created and the standards are set in place. But the work of implementation is done by the state council. So we have a very similar structure, and the details of all of which are available without going into too much of the nitty-gritties. The state council in every state literally replicates that structure from the center, but it is done at the state level, and the state then has full autonomy to go in and inspect, for example, the colleges, inspect the colleges, provide them the licenses, colleges or institutes that are running these degrees. Who gets a license? Who gets, who is eligible for practice or not? Whose license may be withdrawn because you have not sort of kept up with the necessary educational qualifications. All of these are implemented at the state level, and through a central register, which we think is a repository of all the information, the state and the central registers communicate so that the information at all points is communicated. So that's in essence the structure. Okay.
So the idea of the bill is that the center sets the broad policy, which is uniform across the country.
Yes.
And the state councils then go ahead and implement and inspect as to what's happening on the ground.
Absolutely.
Okay. Dr. Tyagi, you're in a council. You've seen the membership of what the councils at the state and the central level have. Do you have what are your take on that?
One thing is that in the composition of the state council, there is a representation from the Medical Council of India, Nursing Council of India, and Rehabilitation Council of India. Since there is no in the state medical council, they should be representative of the state medical council, or state nursing council, not the Medical Council of India or the Nursing Council of India, because they are being represented at the central level also. There should not be any replication of that. There should be only the representation of the state council, state nursing council, state medical council, or state pharmacy council, but not that.
So duplicate representation is what you're saying is should not happen. Between the central and the state councils.
It is a state council which will be looking after the recognition part of that means the other members of that, only the state medical council or the state dental council, not the dental council, state nursing council or state. And one more issue I want to highlight. Since we are designating them as professionals, they should not claim themselves to doctors, first of all, because we have seen that OT technician working at a AIMS or something hospital, then going to his home at the periphery at the village is practicing. Since there are nutritionists, physiotherapists and OT technicians also, so we have to see to it that they don't claim themselves to be doctor. It should be.
Yeah. So what you're saying is there should not be misrepresentation of what an individual is and what he or she can do. Yeah. But I think the law provides for some bit of that. There is an offence which says that if you misrepresent yourself as an allied professional, there's I think a penalty of 50,000 rupees and there's some jail time also.
No, we have seen the rampant of the quackery. Quackery is rampant and all over India, including Delhi. And there are not enough laws, and we have seen that nobody checks them.
Okay, Kavita, you want to respond to that?
Yeah, I think it's a valid point that Dr. Tyagi makes. But I think this is going to be an issue no matter. We see this in every regulator. Even those that have been there, you are always going to have. I think ultimately we make laws so that the honest are kept honest. And then there are going to be cases where we will have to impose penalties, where we will have to ensure. The point of bringing in the law is basically to say that no more can you be allowed to just practice unchecked. Whereas so far, you can go in and get an MRI, you can get an X-ray, somebody is doing your lab. You have no way to verify what the standard, what is this person studied, what is his or her qualification, how many years of practice. The people who are coming to your house to take your blood draw, for regular, who has verified, who has checked, the number of years of, sort of what is the training that has happened. So there is if you think about it, there is a whole group of people touching you when you go for care to a hospital or to a clinic or to a physician's facility. The doctor may be licensed, the nurse may be okay, but a whole host of those folks, we have no idea. So it's very important to set those standards. Obviously, it is up to the, the regulator does to ensure that we keep, in fact, that's the very point. So we will continue to have quacks, we will continue to have people that are there, but that's the whole point is,
and the regulator will step in as and when required and ensure that these things don't happen. Dr. Tyagi, one of the things that we always look at in this program is what is going to the impact, or why is this bill important to our viewers who are watching this program? So why do you think this bill is important for patients who go to a hospital?
Because as I already said, that is till now it is an unregulated sector.
Okay.
And by bringing this act of the bill, it will become a regulated sector, and of course, ultimately we are working for the benefit of the society, and the society at large will be benefited. And one more thing I just want to add on that, in this composition at the state or the central act, there is no representation of the private sector, because in the institution, government alone cannot provide the institutions, or the private sector has to be involved. So in the composition of the central as well as the state, private sector should be given a chance to represent or make it available.
Yeah. Okay. And Kavita, what is the impact? Why is it important? Why is this bill important for hospitals, and why is this important for people who are studying to become allied professionals or healthcare professionals?
I think there are two very important aspects here. One is obviously the safety and quality aspect. Anybody that gets in, if I am a patient, if there is anybody who is touching me in any form of fashion, whether taking my blood, whether, even assisting me in when maybe my parents, or assisting me when I'm not well, moving me, if there is patient contact and if there is patient care, I think in every civilized nation in the world, there is some process to ensure that these folks there is a check in terms of what's happening. So that's critical, that's important. But the bigger part, I think, in terms of, in addition to setting standards, is that this allows for people to aspire for a career in healthcare, which today, until now, we have always thought, you can be a doctor, or then, for all the smart kids, you just say, oh, all I can be is a doctor. Doctor nahi mila because it's tough. We have 10 lakh children who write the NEET exam, and 50,000, people maybe get in there. But this really says not everybody has to be a doctor, but there are some extremely lucrative as well as satisfying, professionally extremely enriching professions where you contribute to the society in a very meaningful way, such as being a physiotherapist, being an occupational therapist, an optometrist, a lab technologist, a mental health professional, for example, a behavioral health counselor, or, folks like that. There are a whole plethora of professions that we've never looked at. And there, I think, is really the opportunity for us to open up healthcare as a sector for both the public and the private. I think for us to get to Ayushman Bharat, we are going to need these professionals across the system, in the public and the private space. Most importantly, in 2030, it is predicted that the world globally is going to have about an 18 million health workforce shortage, is what the WHO has come out with in a major report. That's a report that's been debated, a lot. Even assume there is a small percentage of that we can actually contribute to. I think Indian students and Indian youth will really qualify if there is a proper and a regulated system in place in order to get those jobs.
Great. Thank you, Kavita. Clearly an important bill that will not only set up, standardized processes across the country for allied and healthcare professionals, but also set up, a system where people can, go to accredited institutions and study professional.